Thune, you're free. Chuck, how are you? Give you permission to escape these crowds. Free at last.
Did he tell you about the health care bill there?
Yeah. They're all surrounding John Thune because he has a secret copy of the health care bill in his pocket. Anyway, I want to thank my colleagues, Senators Shaheen, Coons, Schatz, and Heinrich, for joining us here today. Now, last night, Senate Democrats held the floor well into the night to press Republicans on their plan to pass a health care bill that no one in America has seen without holding a single committee hearing or a robust debate on the floor. In my entire career in politics, I've never heard of a more radical or a more reckless process. And to boot, Senator McConnell basically confirmed to me last night in a discussion on the floor that he's planning to allow only 10 hours of total debate time for Democrats on a bill that would affect 1/6 of our economy and the lives of millions of Americans. I think President Trump summed up his health care bill best with one word: mean. Last week at lunch at the White House with Republican senators, the president reportedly told them that he thought the House-passed health care bill was mean. For once, on the topic of health care, my colleagues and I find ourselves agreeing with the president. This bill is mean, very mean. His health care bill is mean. Cutting Medicare to the bone is mean. Cutting treatment for opioid abuse is mean. Cutting support for families with someone in a nursing home is mean. Allowing insurers to once again discriminate against Americans with pre-existing conditions is mean. Charging older Americans as much as 5 times more for their health care is mean. And passing a law that would cause millions of Americans to lose health insurance in order to give a tax break to the uber wealthy is pretty much the textbook definition of a mean bill. Apparently, the president thinks so too. Now, Republicans shouldn't feel like this mean bill cooked up in secret's their only option. For starters, if they were actually serious about improving the American health care system, they'd stop sabotaging the marketplace and threatening to stop the critical cost-sharing payments which help keep deductibles and premiums down. The marketplace and threatening to stop the critical cost-sharing payments which help keep deductibles and premiums down. Senator McConnell keeps talking about they've got to step in because Obamacare is having problems. He's creating the problems, he and President Trump, by not making permanent cost sharing and by discouraging people from signing up. The president and Republicans instead should guarantee that cost sharing payments will be made permanent and stop trying to switch the blame away from their mean bill. They have the power to keep premiums down, and they're purposefully sabotaging the health care system just to try and get a mean bill passed. Second, we've invited our Republican friends to meet us in the old Senate chamber to discuss a bipartisan way forward on health care. We even released a list of all 31 rooms where they can hold formal Senate committee hearings. Plenty of room. Those rooms are waiting with open arms for the Republicans to walk in and have a hearing. Unfortunately, the Republicans seem less interested in working across the aisle to address our nation's most pressing issues, more interested in rushing through President Trump's mean health care bill in the dead of night. Senator Shaheen.
Thank you. I share the concerns of Senator Schumer. I hear these concerns when I talk to people in New Hampshire. It is outrageous that we have 1/6 of our economy being written in secret in a health care bill by 13 men, and that nobody else in the Senate can be part of those deliberations. I was here when we passed the Affordable Care Act. I remember we had almost 100 hearings and roundtables. We had 20 days of session, one of the longest sessions ever in the history of the Senate. We had the longest markup in the Finance Committee in many years, and people had a chance to weigh in. We had Republican amendments. By contrast, this process is both shameful and shameless. Shameful because the American people are being shut out of their democracy, and shameless because the Republican leadership seems to have no qualms about ignoring the voice of the American people. I hear from treatment providers in New Hampshire that if Medicaid is reduced dramatically, which is what we think they're talking about, it will have a huge impact on the heroin and opioid epidemic and the ability of people to get treatment. I hear from women who fear that they are going to lose access to their health care with defunding of Planned Parenthood. I hear from mothers who are worried about whether their kids with pre-existing conditions can still get coverage. The people of New Hampshire and the people of this country have a right to know what the Republicans are doing behind closed doors. This is a life or death situation for many of Americans. And I think I was in the city of Rochester on Monday morning meeting at a hospital with treatment providers. And one of the doctors, I think, expressed the frustration that I've heard from people throughout New Hampshire. She said to me, "Do you mean they're not even going to have a hearing on this bill?" And I had to tell her, sadly, no, there is no hearing planned. Senator Coons.
Well, thank you, Senator Shaheen. I'm hearing the same thing in Delaware that she's hearing in New Hampshire, which is cries of concern and anxiety from parents, from children, from employers, from families, not knowing what will be in the Republican health care bill. We've now just heard from Leader McConnell that there may be a big reveal next Thursday, but this is much more akin to a reality TV show reveal than to the legislative process that should produce a serious and thorough bill that will remake health care in America. As Senator Shaheen mentioned, in the process that produced the Affordable Care Act, there were a remarkable number of hearings. Lots of my constituents have forgotten that record, and we rely on the media to help set this record straight, because some of our colleagues are saying that the process that produced the Affordable Care Act was also secretive, was also behind closed doors, and nothing could be further from the truth. The Senate Finance Committee held more than 50 hearings, roundtables, and walkthroughs, detailed reviews of the bill that were public. They spent 8 days marking up the legislation in committee, during which they considered more than 130 amendments. There were, in the Help Committee, 47 hearings and more than 147 amendments, and Republican amendments were accepted in both of these committees. That's a far cry from the dark of night behind closed doors. We are ashamed of this bill process being followed by the Republicans. Why might that be the case? Because they can't meet the promises made by President Trump being followed by the Republicans. Why might that be the case? Because they can't meet the promises made by President Trump on the campaign trail. He made a few promises, and I quote, "We're going to have insurance for everybody, lower numbers, much lower deductibles, and much less expensive and more better." I don't think that without a hearing, we can know, and without a markup, we can know that the legislative process is going to produce those results. In fact, I'm fairly confident it won't. It doesn't have to be this way. Our entire caucus sent a letter to our Republican colleagues saying, join hands with us and work together to improve the challenges of the Affordable Care Act. As Senator Schumer said, the failure to sustain some of the cost-sharing provisions is what is driving up rates in my state and many others. We could be finding a bipartisan path together, but instead, sadly, our Republican colleagues are choosing to pass an important bill that they've developed behind closed doors, that they will only release at the last moment and without a single hearing. Folks, this is not the way to fix what ails American health care. Thank you. Senator Schatz.
Thank you. A little more on process. You have 13 men, no women. You have 13 Republicans, no Democrats. You have 13 members of the Senate, no expertise, no experts, no hearings. And it's not as though we haven't found time for hearings on other matters. In 2017, the Senate has had hearings on hot tub safety, self-driving cars, a treaty for outer space, multimodal shipping, but no time for even a single hearing on health care. Now to the policy. Tens of millions of people will lose their insurance. There's an estimated 1 million jobs lost by the year 2026. Nursing home residents, new moms will be left without help to pay their high bills. Women will be blocked from health care through Planned Parenthood. And so it will just take one simple thing. It just takes 3 members of the Senate on the Republican side to say, I won't vote for a bill if there's no hearing. You can keep your powder dry and decide how to vote after the public hearing process, but it is not too much to ask. It is not such a profile in courage to ask 3 members of the Senate on the Republican side to insist on a hearing on a bill that will impact 1/6 of the American economy. Senator Heinrich.
Thank you, Senator Schatz. I am normally not one given to hyperbole, but in this case I agree with President Trump. The House bill that they're basing this on is me. And I know that because I'm hearing from constituents each and every day who are scared, who are literally scared for their lives about where their children's health care is going to come from, where their parents' long-term care is going to come from, how their cousin is going to get opioid treatment. We had 1.3 million people hospitalized for opioid and heroin emergencies and inpatient care last year in this country. It is an overwhelming epidemic. And the foundation for treatment for opioids is Medicaid. Like, they can hang the prettiest windows on a house with a crumbling foundation that they want. If you don't have Medicaid well funded to be able to deal with the opioid epidemic, you cannot deal with the opioid epidemic. We're going to see rural hospitals that gave up higher reimbursement rates close down if they don't have the funding from Medicaid, because no one's talking about going back to the reimbursement rates that we had before the ACA, which were higher for hospitals and higher for rural hospitals. They're going to keep that money and cut Medicaid. That's what this proposal looks like. So I got to say, the most frustrating thing about this entire process is every day constituents are calling my office, coming up to me on the streets in New Mexico, and scared to death about what is in this bill, and yet we don't even have a bill that we can point to say exactly what it's going to look like. I've never seen a legislative process like this, but if there's ever an indication that the way we do things in Washington, D.C. is broken, this is the biggest departure from regular order I've ever seen in the decade that I've been here. And it's incredibly scary, it's incredibly disappointing, and yes, it's mean.
One more point here. I'd ask Leader McConnell one question. He says there's going to be a bill available Thursday. To whom? To us? To the American people? To the nurses and doctors and workers who are in health care, the people who have pre-existing conditions? Who is going to be able to see the bill on Thursday? We don't know the answer.
Leader McConnell just said that the reason that Republicans haven't included you is because it's been clear from the beginning that Democrats are not interested in doing anything to fix Obamacare.
Yeah, the bottom line is we've sent him umpteen letters that say just the opposite. Say we want to make Obamacare better, and sit down with us and figure out how. They have insisted on repeal, even though they never had a repeal plan. And repeal causes such huge damage, as embodied in Trump Care, that only 18% of Americans are for it. He should sit down with us with no preconditions if he wants to talk. And we're ready to do that.
Did they ever seek out negotiations?
Never sought out negotiations, never sought our opinions, just decided to do this in the dark of night. It's amazing that most of their Republican members don't know what this bill is about either. And why? They're ashamed. I'd be ashamed if I had this bill, and they are ashamed, yes.
Are you going to negotiate with Republicans on increasing the debt ceiling? I mean, the position of national Democrats is not going to negotiate on this. There's now a Republican president, so have things changed?
Well, I'd say two things. The onus is on the Republicans. They have the presidency, the House, and Senate. The onus is on them to deal with the debt ceiling. And I'd say another thing. If they're going to put on the table a massive tax cut for the very wealthy that increases the deficit by trillions, it's harder to get Democrats to increase the debt ceiling.
Leader Schumer, you talk about the limiting process in reconciliation here, and that should be limited in amendments. But that said, do you feel the shoe is on the other foot here? When the Democrats passed the bills, some years ago, I know there was a long vote-a-rama.
There are over 170.
But still, it's a limited
Oh,
process.
please. No. That's just wrong. There are over 170 amendments offered, many in committee, finance, and health, many on the floor, and open debate. There was not just a vote-a-rama. There was unlimited, basically, debate. It's night and day.
During the last healthcare debate, the Democratic healthcare bill was going on. There was a conflict of what we heard about the conference committee being televised. Do you want the conference committee this time around to be televised?
Well, we'll see if there is a conference committee, but the more openness, the better. I would want it televised.
You kept conferees being appointed, which is what happened in 2000.
Well, we'll have to wait and see. I mean, this process has been so bankrupt. It's hard to opine on future speculative proposals.
Senator Schumer.
Last one.
If the bill is released on Thursday.
Made public, meaning.
Made public on Thursday. What do you anticipate happening this weekend, assuming that...
Yeah, I would assume that once the public sees this bill, there'll be the same outcry there was against the House bill, but it may have even greater effect because the Senate Republicans have less margin for error. Thank you.
Well, good afternoon, everyone. We had Secretary Tom Price at lunch today and continued our discussions of the way forward on health care. As all of you know, because I've reported it weekly, for weeks now we've been in intense discussions with all Republican senators, both in working groups that all members were free to come to if they chose to, and in the larger lunches that we have on Tuesday, Wednesday, and Thursday. I expect to have a discussion draft on Thursday, and we will go to the bill, obviously, once we get a CBO score, likely next week.
So we've been waiting for our Democratic colleagues to join us as part of this rescue mission to protect the millions of people for whom Obamacare has been a disaster, with premiums going up 105% since 2013. Many people have deductibles that render their insurance essentially unusable. So you would think ordinarily they would want to work with us in a bipartisan way to try to help these people who are hurting as a result of the... They would want to work with us in a bipartisan way to try to help these people who are hurting as a result of the failures of Obamacare. Unfortunately, they're spending their time and energy giving speeches to each other on the Senate floor and absolutely contributing nothing toward a solution to this problem. I think it is worthwhile asking, what is the Democratic alternative over the status quo? The status quo clearly is unacceptable, and I think what you have to look at is that of one of their leading presidential nominees, candidates, that's Bernie Sanders, who's proposed the ideal Democratic response, which is a single-payer system. The National Urban Institute scored his bill, found that it would cost over $500 billion in 2017 alone. And over the projected life of the bill through 2026, it would cost $6.6 trillion. That is the Democratic alternative, Bernie Sanders' single-payer system that would cost $6.6 trillion over the next 10 years. That's not a viable alternative for a vibrant economy that will put people back to work, and that's not giving people the kind of health care they want at a price they can afford.
It is high time that we turn the page on this failed Obamacare experiment. The last several elections have helped elect a lot of Republicans, and the people around this country who voted in those elections made it very clear that Obamacare was a major issue in why they voted. And we've been debating this now for 7 years. There have been lots of discussions about what the issues are. We all know what the issues are, and it's time for us now to move forward with a solution that will be a better one and an improvement for the American people. And a better solution for the American people, we believe, helps bring stability to the marketplace, and markets, as we all know, are collapsing. There are going to be 40 to 45% of Americans next year in counties where there is only one insurance option. Well, one option is not a market. One competitor is not a market. And the second thing, of course, is to try and address the issue of skyrocketing premiums and to make health insurance in this country more affordable for most Americans. And so we intend to accomplish that objective. We also want to make sure that we protect people with pre-existing conditions. And we want to make Medicaid sustainable by giving states flexibility so that they can design programs that work best for their populations while at the same time they protect those who need that program and ensure that the rug is not pulled out from under them. Those are the objectives that will have guided our discussions. Those are the objectives that we intend to achieve, and we're committed to getting an outcome that is a much better one for the American people, because Obamacare is unsustainable, the status quo is unacceptable.
Well, you've heard from my colleagues that the pain of Obamacare is getting worse for people all across the country in terms of increasing costs, fewer choices. But I want to take a moment to talk about really the most detested part of the Obama health care law, which was the individual mandate. Where the law says you must buy a government-approved product or pay a fine, pay a fee, pay a tax. People do not like this anywhere, and the Republicans in the House have voted to eliminate it, and the Republicans in the Senate are committed to do the same. We know that 6 million people chose to pay the fine according to the IRS, and we know that another 13 million got waivers from having to pay the fine but not having to buy Obamacare insurance. So there are 19 million people who of their own volition decided, I don't want Obamacare. When the CBO came out with its report following the House passage of the bill, which eliminated the individual mandate, they said there'd be fewer people on Obamacare a year later if we eliminate the mandate. They actually had a number over 10 million people. And when you go to the fine print of the CBO report, it is saying most of this is because of elimination of the individual mandate. It's something we are committed to do. People didn't want to have to buy this product. This is a sinking ship. People are ready to jump off, and we eliminate the individual mandate. You'll see more people as free citizens making a decision to not have Obamacare insurance, but certainly have more freedom. We're committed to replacing the Obamacare health care law with something that will give the American people the care they need from a doctor they choose at lower costs.
You're going to hear often this week that Obamacare is failing because Republicans in the White House and the Congress decided not to support it. Obamacare was failing long before that. You know, there are a third of the counties in the country today don't have more than one company who's willing to offer insurance in the individual market. Those decisions had to be made last summer before the election. Now, to offer insurance in the individual market, those decisions had to be made last summer before the election. Now, it's going to go from a third to 40 or 45% next year. There'll be multiple states that only have one company that's willing to offer a product in the Obamacare market. And those are decisions that this Congress and this president had nothing to do with. This is a failing system. It needs to be repealed and replaced with a system that works better. That's what we're making an effort to do with all the protections that have been mentioned here today for sustainable Medicaid, for access with people with pre-existing conditions, no caps on future policies, continue to be able to stay on your insurance if your family has insurance and you're 26 or under. But this system is not working. It's clearly imploding. It didn't just happen in January or December or November. I think the average individual market insurance since 2013, the price has gone up 105%. 145% in Missouri, and in my state, 25 counties at this point appear they'll have nobody offering insurance with a law on the books that says you have to buy insurance, even though that insurance wouldn't be available. Obviously, this isn't working. It needs to be fixed. We're prepared to work to fix it.
Nancy.
The president said today that the health care bill needs more heart than the House version. How will your bill have more heart, as the president puts it, than the House version?
Well, we're going to lay out a discussion draft Thursday morning. You'll be able to take a look at it. I think you've heard from some of my colleagues the likely highlights of it. And I wouldn't want to compare it to the House bill. It'll speak for itself. It'll be different. and take a different approach based upon these endless discussions we've had with the only people interested in changing the law, which is Republican senators.
Well, you say that Democrats aren't interested, but they're not invited into.
Well, they wouldn't. They've made it clear earlier they were not interested in participating in this. They have no interest in it whatsoever. So it makes no sense.
So are they invited into your planning sessions?
Into the Republican conference, no. But they made it clear they're not interested in helping. They are not interested in what we're trying to achieve at all. And I do find it particularly laughable, the complaints about process. For any of you who were around here in December of 2009, the Senate went into session on the Monday after Thanksgiving and was in continuously 7 days a week, 7 days a week until Christmas Eve, at which point people traipsed in and out of the Majority Leader's office to produce the draft that they passed 60-40 on Christmas Eve. So look, all of that is irrelevant. We know they don't want to participate in what we're trying to achieve, which is to change Obamacare and make it better.
Senator McConnell,
yeah.
you must be very confident that this bill is going to pass, number one. And number two, are you willing to burn a reconciliation package if it's not?
We're going to make every effort to pass a bill that dramatically changes the current health care law.
But that's not confidence necessarily. I mean, you wouldn't bring a bill up unless you were confident, right?
Mr. Leader, how long will the American public have to read this bill? How many days?
Oh, they'll have plenty of time. Yeah, plenty of time. We've been discussing all the elements of this endlessly for 7 years. Everybody pretty well understands it. Everybody will have an adequate time to take a look at it. I think this will be about as transparent as it could be. No transparency would have been added by having hearings in which Democrats offered endless single-payer system amendments. That is not what this Republican Senate was sent here to do.
But Mr. Leader, this bill is bound to have a profound impact on the country.
It's going to have a profound positive improvement over the status quo.
So do Americans that have a
The status quo is simply unsustainable, as all of our members have pointed out. To ignore that the status quo is imploding is to ignore reality. We think we can do better than that, and we fully intend to.